All right, we are live. Hello, everybody. My name is Dr.Simran, and I have my wonderful friend here, Dr. Angelica.
Hello.
We're going to just click go live on Instagram here so we can see your comments. We are live on Instagram, on YouTube, and on Facebook today. So please go and invite your friends. And I will give us a little bit of a kickoff and introduction of who we are and why we're here today. My name is Dr. Malhotra, and I am a triple board certified physician in internal medicine. I spent a decade of my career working in hospice and palliative care, so caring for the sickest of the people, oftentimes at the end of life from chronic illness. And then my third certification is in lifestyle medicine. Along with that, I'm also a lifestyle and wellness coach, and just have a huge passion for sharing knowledge and tools that I've learned over my career and, through my own personal experiences to help people not just live better lives and improve their quality of life, but really reduce their risk of chronic illness and improve their longevity. And along my journey, I recently met Dr. Angelica, and we decided to come together and share both of our experience and expertise with you to empower you to take this information and better your lives. Now, anything we share today is not medical advice, so it is education for you to take back and make your life better. Today, we're going to be talking about the silent killers. So after Dr. Angelica introduces herself, we'll talk a little bit more about what that means, but please share this with your friends and invite them to this stream.
Yes, thank you so much for that lovely intro, Dr. Simran. It's been so lovely connecting with you on this journey in our pursuit of sharing more education for our communities that they can take forward to their loved ones and their own communities. What really led me on my journey of, holistic lifestyle medicine was exploring how to support my family through making sure they weren't affected by all of these different chronic yet preventable conditions. So, my rabbit hole of education was becoming a doctor of physical therapy. And in that, I realized a lot of my patients needed more support from knowing how to nourish their bodies, how to improve their sleep quality, how to manage their stress. So that's what led me to becoming a certified integrative health coach. And then from that point, I've just utilized both of these things in my practice to really support my patients in a more integrative container. So that's where I'm at right now. And that's what led us to here. So I'm excited to get into it with you today.
That is so beautiful. Thank you for sharing. And, we know that we need more people like us sharing evidence-based, science-based information that really takes into account the whole person, right? Mind, body, spirit, because we are not just a singular organ or a singular piece. We are beautiful human creatures, and our bodies are complex and our lives are complex. And so we really have to look at it from a big picture perspective of what makes sense for that person. So we're hoping you'll take away something from our talk today, which I think is so, so important. And it's all about the silent killers. I'll just give you a little personal anecdote. Okay. So I spent 10 years of my life working in hospice and palliative care. And at the beginning, I didn't really know much better, just like most conventionally trained doctors. You diagnose someone with high blood pressure and you diagnose someone with diabetes, and eventually they get heart disease, eventually they have a stroke, and you just continue to give them medications and or do some sort of treatment to try to manage their disease and slow down the progression of this disease. And eventually you get to a point where either the treatments aren't working anymore, or the person's quality of life is so poor, they're so debilitated that they're kind of like, I don't really want to live anymore, because at this point I'm existing and I'm not really living. And that's really where they get introduced to a doctor like me who practices palliative care, or the goal of improving someone's quality of life while they're living with serious illness until the end of their physical life comes. So this was kind of what I knew. This was how I was trained. This is what I knew was the normal until about, 10 years ago, I became the patient and I really started learning about what is lifestyle medicine and what is, the different factors in our lifestyle that affect whether we're going to get a disease or whether we're not. And this opened my eyes to a whole new world because I wasn't taught this way, right? And about, I would say 2 or 3 years ago, I really got to a place in my career where I started to become really unsatisfied. And I noticed that people were getting sicker at a younger age, and the treatments we were doing were not as effective, meaning their quality of life was worse, but they were also getting sicker at a faster rate and dying at a younger age. And this started to get to me because I'm like, you know, 70 to 80% of these diseases that they're dying from are preventable through our lifestyle and the way that we live. End stage diabetes, end stage heart disease, end stage dementia, end stage kidney disease. These are the end stage complications of what we're going to talk about today, which is the silent killers. And the reason I tell you this story is because my patients didn't just get end stage heart failure waiting for a transplant overnight. They didn't just end up with end stage kidney disease starting dialysis overnight. They didn't just have a massive stroke that completely debilitated them overnight. They have been taking medications for decades, 10, 20, 30, 40 decades of medication for things like high blood pressure, high cholesterol, diabetes. And over the many years of their disease progressing, they got to the end stage complications. And that is really the takeaway point for today. But I wanted to give you my insight of what I've seen in my career because it is so important for people to know this because most people think, oh, I just have high blood pressure. I just have high cholesterol. It's not a big deal. So I'm going to pull up our slide deck and I'm going to hand it over to Dr. Angelica.
Yeah, thank you for sharing that story, Dr. Malhotra. I mean, the perspective you have, I just wanted to mention before we get going into it. As a palliative medicine doctor, I mean, many of us go to your perspective and other professionals who are like, well, what do I do now? How do I just continue to manage my life or the life of my loved ones, just treating the symptoms, but never actually addressing, well, are there ways in how we can reverse it? And, just as you were getting into it, I'm excited for us to start sharing, there are ways that we can really get ahead of this as early as our 20s, as early as our 30s. And it starts with the education and the awareness. So let's get right in.
And to my moms out there, it starts now for our kids. It starts now for our kids because now we're living in a modern lifestyle where it's not just us getting affected by these chronic illnesses, but our pediatricians are having to treat high blood pressure, cholesterol, and diabetes in kids as young as 10 to 12 years old. So everything we're talking about today applies to us and our kids because the shocking statistic is that our kids today are the first generation at risk of dying before us.
That is so heavy. And I'm so glad that you bring up that point because it just shows how much more important it is for us to shed this awareness so that we can, save our generation who's supposed to be the future, right? So as we get into it, we're going to talk about the silent killers. What we hear is common conditions, whether it's heart disease, stroke, diabetes, these things we always hear, like you mentioned, oh, well, I was just diagnosed with this. But have we ever actually learned about what are the things or the precursors that had led up to how these things come about? And honestly, by the time these symptoms do appear and the blood work shows that we have some form of diabetes or blood work disorder, that's where a lot of damage has already been done. But there is so much that still can be done, as I just mentioned, as long as we are really getting to the early signs and symptoms, which we're going to get into. So, as we were mentioning, heart disease and diabetes, these things impact so many of our loved ones, including ourselves and even our children today. So, there is a shocking statistic as well that 1 in 5 people today who experience a heart attack are under the age of 40, whereas not too long ago, the average male was around 45 years old and a female was around 55. And things and variables that could have contributed to that are many, but most of it does come from our lifestyle.
Yeah. And I'll just say, you know, this is very much in line with what I was seeing in my career in palliative care. A lot of people were thinking, you know, my average age patient is in their 90s. But really, you know, I had the average patient probably in their 50s or 60s, even people as young as their 30s or 40s, you know, waiting for a heart transplant from end stage heart disease, from multiple heart attacks, from years and years of diabetes and high blood pressure. Right. So I think that's important. And I think the statistic, you know, we're worried about a lot of different conditions, especially this month, right? It's October now. So, you know, we're talking about breast cancer awareness.
Mhm.
And I think that's really important, right? 1 in 8 women will get breast cancer, right? But even more women will get and die from heart disease. And so I think it's such a big thing to talk about, especially as you and I are very passionate about talking about women's health. And as you know, women, as we get into perimenopause and menopause, what we don't realize is that our risk of heart disease goes exponentially up because we no longer have that estrogen protecting our heart, our brain, our bones. So it's even more important. So what does this look like? The evolution. So I have a very cool model that I'm going to show you at the end to really give you a visual appeal of what this looks like in the artery of your heart. But this progression through the life stages, it says 20s, but right now we have evidence from autopsy reports of children as young as 13 years old with the very first signs of heart disease. And that is usually known as a fatty streak. So this is starting very young these days. And this is the part where it's like, just because you can't see it doesn't mean it's not there. And that's what's known as the invincible era. And what's causing this, right?
Mhm.
There's probably the big, you know, 4 or 5 lifestyle factors. And I'll just say, you know, before I go forward, there are a lot of conditions that have a hereditary or genetic component. And as someone who has a genetic mutation for cancer, I'm very passionate about giving a disclaimer for that this doesn't apply to everybody. However, you know, people that are affected by a genetic mutation, whether it be for cancer or for high cholesterol, only really account for 5 to 10% of the population. So everything we're talking about today really applies to majority of the population for the average person. And we know that 70 to 80% of these chronic diseases we're talking about are lifestyle related. So what are those factors, right? The number one thing, what are we doing multiple times a day? Eating, right?
Mm-hmm.
So we talked about this last week. What kind of carbohydrates, processed foods? The average American's daily calories come from 60 to 65% processed and ultra processed foods. For our kids, it's up to 70% of their daily calories that are coming from processed and ultra processed foods. And these foods, we know, science has now showed us, are linked to all of these chronic illnesses that we've been talking about today. We are, you know, more sedentary than we've ever been before. We are living in this modern lifestyle where we're managing so many different things between family and work and aging parents, and so many things. Our sleep is horrible, and sleep is a foundational lifestyle pillar that we know if our sleep quality is poor, if we're not getting enough sleep, increases our risk of heart disease, increases our risk of obesity, increases our risk of diabetes and cancer. So what do these early symptoms look like? They could be very vague. You could very much just put these symptoms off to like stress from work or being tired because you have young kids or any of these things. But what do these symptoms look like? Being really tired, having trouble, always going on a yo-yo diet, having trouble managing your weight, having sugar cravings, always being hungry, having brain fog, never feeling like you have energy. Anything else I missed that you see in your patients?
For sure, sleep quality. I feel like during this time, it's all over the place. And we're just like, oh, chalk it up to having less than 5 hours of sleep because we probably were out the night before and then just went right back into work the next day. And then stress management for sure is something that I wanted to bring up as well, because many times we do think much of our symptoms are stress that influences us mentally, but it is impacting us physiologically more than ever. And it also increases the stress hormones in our bodies. So if we don't have the resilience to manage the natural stressors in our day-to-day life, we are just going to experience so many of these different physiological risks so much greater. So that's also a big thing that I've been noticing too.
And I think one of the things that shocks people is when I tell them that the third leading risk factor for heart disease is stress.
Yeah. It's something that we almost take for granted, in society. It's like, of course I'm stressed. And the biggest thing, I don't know if you've also felt this, Dr. Malhotra, is that we use stress as like a badge of honor. It's like, if we're not stressed, what are you doing? Right. And
I was just going to say that it's like, if I'm not stressed and if I'm cutting short my sleep, I'm productive, like I am, a high achiever. Yet these are the little lifestyle habits over time that really have the greatest impact on our health. And we're role modeling. We're role modeling for our children. We're role modeling for our spouse. We're role modeling for everyone in our inner circle, our patients. I mean, as healthcare providers, there's actually studies showing that if your doctor or your healthcare provider, has unhealthy lifestyle habits versus healthy lifestyle habits, their patients will mirror their doctor or their healthcare provider. I mean, this specific study is in doctors, but I'm sure whatever sort of medical provider you're seeing, that's true. So it's crazy, guys.
That reminds me of, I forgot what book I read, but it was just describing about how doctors before in indigenous tribes, they were only compensated when the entire village was doing really well and they were all healthy. But that had to model after the doctor being the mentor and the guide. And more than ever, it's really evolving, and it's definitely not a blanket statement that we would make upon all healthcare practitioners, but we see the general masses of healthcare practitioners who are experiencing higher rates of burnout and compassion fatigue more than ever. So it's like, how do we, expect them to be that, that golden light for us to look up to when they themselves are also experiencing many of these different symptoms and even chronic conditions as well?
100%. 100%. I mean, I see it in so many of my colleagues. All right. So then what does this look like? So over the years, you have these symptoms and, they continue to just build up, right? And slowly you may develop signs of what we call insulin resistance or metabolic dysfunction. So this is where your blood work may start to look abnormal, but not abnormal enough for the doctor to be like, oh, it's, we need to treat you medically. And I think this is the part where traditional medicine gets it wrong. We don't tend to look at things in trends enough, right? So if over the years your fasting blood sugar is going up or your cholesterol is slowly going up, we don't nip it in the bud by addressing the root cause, which is our lifestyle. But instead, usually it's not discussed until the cholesterol is really high or the fasting blood sugar is now in the pre-diabetic or metabolically dysfunctional range. And all the while, the person is feeling bad, but they don't know why, because their blood work, quote unquote, is still normal because it's not raising any red flags, but they know they don't feel well, right? The brain fog gets worse, the fatigue gets worse, the weight gain, all of these things and are heightened by all of the stressors in our life between work, kids, and just, we live in the sandwich era right now.
Right.
Young kids, old parents. It's
Right.
hard, right?
Yeah,
So
100%.
and this is 30s to 40s. I would say right now, as we're seeing it, you mentioned rates of heart attacks going higher in 40s. It's not uncommon for people to be full-blown diabetic in their 30s now. The rates of cancer, many different types of cancers, are going up for people in their 40s specifically. So I think, this number, even at this point, people are already full-blown getting the disease in the time that we're living.
Yeah,
Which is
especially now. I don't know if from the time just, when I was growing up, I always imagined when these symptoms or conditions were diagnosed, it was in our later years,
Mhm.
but now I have colleagues and friends who are managing their high blood pressure and cholesterol levels. So it's just a matter of what has changed so much in the most recent years. And it really comes down to lifestyle. So now leading to a lot of these different early precursor symptoms we've just been discussing, such as brain fog, increased fatigue, increased weight gain, especially around the abdomen. We keep noticing this pattern happening in nearly 93% of American adults today. And what we're not realizing is there is a root that is connecting all of these different symptoms known as insulin resistance. And insulin resistance is when the cells in our bodies aren't responding as well to the hormone known as insulin that gets produced in our body to help with regulating blood sugar. And what happens now is the blood sugar starts to get really, really high, and our body is naturally going to keep trying to produce more insulin to try calming that down. But that increased insulin now is just going to start to lead to increased weight gain, and all of those other symptoms that we were just mentioning. So it's important for us to really address the root cause of what these different symptoms are leading to. So
and it's important to recognize that a lot of the issues that we're having today, whether, and this is especially important, I'll point out for our women that are in that menopausal area, or women that are dealing with a lot of fertility issues. So things like PCOS or non-alcoholic fatty liver disease, we don't think about those things as metabolic diseases, but they really are. At the root cause, it's metabolic dysfunction and insulin resistance that is leading to those. So over time, from a heart disease perspective, you're going to get insulin resistance, and or another word for it is metabolic dysfunction. And then the next step from there, you'll get diagnosed with either high blood pressure or high cholesterol. Now there's other pathways to getting these diseases too, but we're really talking about it for the majority of the population and how our lifestyle affects this. And so from there, that high blood pressure and high cholesterol, as we'll see on the next slide, is going to progress into the next stage, which is really diabetes. And after many, many years of having high blood pressure, high cholesterol, pre-diabetes, then diabetes, this ultimately will then lead to things like heart disease, and you need things like stents or a triple bypass surgery. And eventually, medical management, surgical management will only go so far, and that'll then take you to, things like congestive heart failure and, a stroke or end-stage kidney disease. So these are kind of like the end stages. And I think I jumped ahead, but I think we kind of already talked about this.
Yeah.
I think, what's important to recognize before we go there about insulin is that before we talk about, we talked about end stage. So let's go to insulin and how our lifestyle affects insulin. So what is insulin? Insulin is our energy storage hormone. And it has, every single time we eat, basically it impacts our insulin levels. But every single time that we're stressed, and our stress hormone goes up, like cortisol, it also impacts our insulin levels. if we're sleeping well or not sleeping well, that impacts our insulin levels. Whether we're exercising or not exercising, that impacts our insulin levels. So it's important to recognize that all of these diseases can be impacted by insulin and our lifestyle habits from many different angles. Okay, so
getting into how can we start to address these silent killers before they truly proliferate into some of the things that Dr. Malhotra was just talking about, such as end stage kidney, heart disease, and diabetes. So small changes really go such a long way as early as in, our children today, in wherever we are in the lifespan. But what we need to focus on are the lifestyle factors of really incorporating more whole foods into our diet. More than ever, as we've been mentioning, much of the American diet is, highly processed and refined foods. One, of course, we have to consider what is the accessibility of these things, but even just adding, a cup of vegetables or a cup of greens to, one or two meals in the day can really make a big difference over the long run. But over time, the goal is for us to aim for incorporating really diverse numbers of plants, fruits, nuts, legumes into our diet so that it can support our overall gut health and just the different vitamins and minerals that we need to combat a lot of these different diseases. And then a big thing that I'm so passionate about is how movement is truly medicine. There's been so much research out showing that after eating a meal, if we walk just for about 30 minutes, that can significantly decrease our blood sugar levels by around 30%. So it doesn't have to take, such significant strides to, really reduce our risk factors, but even making one small change and really dedicating to that consistently will make a profound difference. And then stress management too. Just as you had mentioned earlier, our insulin levels are so sensitive to our stress hormone cortisol. So incorporating, into our lifestyle different activities that can just help us with calming down our stress levels and making sure that we have spaces to regulate our nervous system, because in this day and age, it's like all of us are constantly in this fight or flight stage, right? For those of you who don't know, our bodies can either be in two different states of being. We're either in this fight or flight phase where it almost feels like our body is preparing for a fight, or the feeling that we get when we're in traffic, right? Or on the other hand, we're in this rest, digest, and healing and recovery phase where so much of our digestion happens when we're healing certain injuries, or certain inflammatory markers in our bodies can actually finally calm down, which is why sleep is also so important. But when our stress is so rampant and we're always on that on alert phase, then that is going to start to take a toll on our sleep. So they really go hand in hand. For those of you who experience difficulties or trouble sleeping, I would start to consider, is there one small habit or activity that you can do that can help calm down your mind and your nervous system right before going to bed? And then before we get into talking about the Feel Great system, anything else that you feel would be beneficial to add in regards to really making some effective lifestyle changes?
I mean, I think you kind of nailed all of them on the head. I think eating more plants, more fiber will reduce our risk of all these diseases. Moving for at least 10 minutes after each meal is a great place to start if you can't get in a full 30 minutes or longer in a day. And we have research to show that even increments of 10 minutes of movement at a time reduces all-cause mortality from many different disease states. And then, the sleep piece, I think, is what most people struggle with. And so I love your idea of optimize your sleep hygiene. If there's something that, will help you calm down, whether it's, reading a book, taking a warm shower, doing something I did with a lot of my patients, because a lot of them obviously had very high anxiety, living with serious illness and a lot of symptoms, is something called a brain dump. So they would keep a journal by their bedside. And what I would encourage them to do is to literally take the journal and or an audio recorder and just write down everything that they're thinking, and not think about what they're thinking, just write it down. Because as soon as you write it down or record it, you say it out loud, you have now released it, and you can kind of feel calmer, which will allow you to fall asleep better. So, and then the last piece is the feel great system. And before we get to that, let me give you this visual, because I used to show this to a lot of my, or I do show this to a lot of my clients. So this is our artery. Okay. This is the artery of our heart. So there's 3 layers. So the internal layer is called the endocardium, right? That red layer right there is called the myocardium, or the heart muscle. And then the top layer is called the epicardium. So this is what it looks like to have a normal, healthy, coronary artery or heart artery, right? Over years, we start with some of these lifestyle habits, and you can probably see, maybe not, some yellow streaks in there. And those are what I was talking about, the fatty streaks. Okay. Can't really see it. It's kind of there, but not really. Okay. But then now, over another decade or so, you've developed some high cholesterol. Maybe you're diabetic at this point. Maybe you've got pre-diabetes. Maybe you've got high blood pressure. But you're starting to build up that. Oh, that's why, because I'm showing the wrong side. You're starting to build up that plaque. So you can see, right? So maybe this is in your 30s. Maybe this is in your 30s, right? But maybe this was in your 20s, right? So it's kind of there, building up slowly over time. You can't really feel it until you hit 45. And guess what? You've got lots of plaque in there, and you now have a massive clot in your artery. And this massive clot is blocking the blood supply to your main heart artery. And now you've had a massive heart attack. You have the elephant sitting on the chest. You can't breathe. You're rushed to the hospital, and you've been told you have a massive heart attack. And most people think, well, I'm healthy. I was fine. I have no medical problems. But guess what? High blood pressure, high cholesterol. These are all medical problems down the road that will lead to this. A heart attack does not happen overnight. A stroke does not happen overnight. Your kidneys don't die overnight. Mm-hmm. So it's really important to have that visual of what happens over the years.
That was really helpful. That visual just really puts everything we were talking about into practice, or just ingrains the severity of what can happen when we don't pay attention to some of these lifestyle factors that are really changing everything on the inside, so.
And I want to point out, like, it is possible to have healthy, clean arteries, right? This belief system we have in society of, as we age, we have to get sick, or like, because it runs in my family, I'm destined to get it. I mean, these are all belief systems that really need to be broken and reframed, because and they've done tons of studies in twins showing that, if each twin lives a completely different lifestyle, their outcomes for disease are completely different. So we have more control than we're often led to believe. And it's really, really important to empower yourself and have that belief system. So going back to the Feel Great system. So this is how Dr. Angelica and I actually met. For me and my husband, 10 years ago, we came across this system. We were both in medical training, high pace, fast life. My husband, was found to have high blood pressure, borderline high cholesterol, and he was pre-diabetic. He was 34. You honestly never would have known, but we had life insurance blood work done, and we found out all these things. He looked like a skinny, otherwise healthy 34-year-old, and had every single one of these silent killers that we talked about today. Insane, right? And a good friend of mine told us about this system. We did the 12-week coaching program. And by the end of the 12 weeks, he had dropped about 20 pounds, inches off his waist, reversed all 3 of those things. and I had lost about 15 pounds, inches off my waist. And that started our lifestyle and plant-based journey from there. And 10 years later, we are in the exact same metabolic health that we were 10 years ago. And this system is the kickstart to that. And this system is really for the person right now who's like, great, I understand everything you doctors are saying, and I appreciate it. I have some of these silent, issues, or I feel horrible, and I understand that I might be metabolically healthy. But I also work 2 jobs. I also have little kids. I also have a spouse that works. I also don't have any help. That's who this system is for. It's really, the way I see it with my clients is it's the momentum fuel that most of us living in the modern lifestyle need to kickstart our lifestyle changes. And we're gonna walk you through what it looks like real quick. So this system is 2 simple plant-based products with a practice of time-restricted eating. We'll do a whole nother live on the powers of time-restricted eating and intermittent fasting to optimize something called metabolic flexibility. So this is our body's ability to use the food and sugar that we eat for fuel, but also use our body's own fat for fuel, right? So fat being stored in too many of the wrong places, like our muscle and our liver and around our organs in our midsection, is really down the road what leads to insulin resistance. You have a fat or energy storage problem. So we need to learn how to use our own energy for fuel. And that's what this system does. So the first product is something called Unimate. Okay, it's a concentrated, purified version of yerba mate. And essentially what it does is it is an incredible tool to optimize our metabolic health and allow us to optimize that fasting. So you see in the morning, that fire is really us drinking the Unimate and burning our own fat for fuel. So it increases our body's own ketone production. So that's fat, right? It kills the cravings, it kills the hunger cues, and allows us to fast until we eat our first meal. Okay. And what this is really is a beautiful tool to allow you to fast without struggling.
Mm-hmm. It really helps with the food noise,
It helps with the food noise. And then it's also, if you're someone that loves coffee or someone, and I just had a client yesterday, she's like, I don't need coffee anymore, right? And so what this is a concentrated form of something called chlorogenic acids and theobromine. Those are compounds that we find in coffee and in green tea that are really, really good for us. So we hear about the heart benefits and the brain benefits of coffee. Those come from chlorogenic acid. Well, the Unimate gives you over 100 times the amount of chlorogenic acid than you would get in a cup of coffee. So it's not just good for your metabolic health, it's good for your mental health as well. So most of my clients that are on this, they're like, my energy is insane and I just feel good, right? So we do that. So we do the Unimate in the morning. Then in the afternoon, when we all reach for that mid-afternoon coffee, because all of us get that like afternoon crash, that's actually physiological, but it can get worse if you are eating a highly processed diet, if you're just sitting all day, that mid-afternoon crash gets worse. So that's where we have the Unimate again, because it's going to cancel the food noise, allow us to fast in the afternoon. We don't need snacks. We don't need to reach for a coffee. We're going to have our Unimate, okay? And then in the evening, we're going to swap and have something called our balance. Now, the way I see balance for us, we've been using this product for many years now, and the company that creates these products, I really respect them because they do a lot of science internally, but also externally on their products. And this product is phenomenal because I see it as my multivitamin, right? So it has a blend of vitamins and minerals, but then it also has a 7-fiber blend of insoluble and soluble fibers. And it's been shown to help you regulate your blood sugar levels, shows to regulate your cholesterol levels, and helps you feel full so that you don't overeat. And we know, especially in the evening, the overeating can happen if you're eating with a lot of people and all of that. And we know that our body doesn't metabolize food the same in the evening as it does in the morning. It's much harder for our body to break everything down in the evening. And so this product really helps regulate the blood sugar, cholesterol, all of that. So simple system. And the company is so phenomenal that they actually give a 90-day money back blood work guarantee. So whether you're pre-diabetic, you've got cholesterol, high blood pressure, you're trying to lose weight around that midsection, people see results.
Great starter. Yeah. I mean, when I started taking it myself a few months ago, I mean, I didn't realize how bad my cravings were for sugar, like truthfully so. And then when I started taking this system consistently, it reduced my sugar cravings. Literally, I don't crave sugar anymore. And anyone in my close realm would say that I was like the sugar monster. And now I've, given it to family I've recommended it to some of my patients as well. And I just had a patient who came in yesterday and said he had his blood work done after 3 weeks of taking it. His cholesterol levels went down so much. His doctor called and was like, "You need to get off your statins."
Nice.
I was like, this was all experimental because he was like, "I don't know what to do. I just have been on my medications for so long and I'm experiencing, skin tags and low energy levels and all of those insulin resistant markers." And finally, he's like, "I really see this helping me in the long run." And it's so motivating to hear those stories, because for people who have been told that there's no other option than the medication route, it is such a great way to instill that hope that you can live a life outside of relying so heavily on these medications. And I do disclaim there is a time and a place, and depending on where your certain situation is and what your needs are. But if your goals are to not constantly be dictated by some form of medication for the rest of your life, this is a wonderful tool to support you in doing so.
Absolutely. And if you have, as you're listening to this, if you have any questions about the system or about anything that we've shared today, please share them in the comments, and or just shoot either of us a message afterwards, and we would be happy to chat with you about it. But I agree with what Angelica just said, right? There's a time and place for modern medicine and medications, especially if, say, you're having a massive heart attack. Gosh, you need to go to the hospital because it's not saving your life, right? But what this system does is really work synergistically alongside any medications you're taking, or maybe you're not taking any medications. You're just got the risk factors for these chronic metabolic diseases. And the number of people I've seen come off of medications is phenomenal. And so the way I see this system is twofold. Number one, you need to make lifestyle changes. You want to make lifestyle changes, but you need time to do that, right? Mm-hmm. I never, ever support radical lifestyle changes because it's not sustainable, right? Mm-hmm. That's the whole New Year's gold thing. It always falls through, right? And so this is, the system is momentum. Okay. So over that 90-day period, as you're, slowly adding those lifestyle changes, you have the system working for you and giving you momentum. I had a client the other day and she was like, "I just lost 25 pounds in the last 7 weeks." And she's like, "I have this huge event coming up." And she's like, "I have not gone dress shopping in years because I just didn't like the way I look." And she was glowing. And that is what life is all about. It's about that quality of life. It's about the zest and the joy you get from these everyday things. And you want to feel good in your body, right? So this gives you the momentum. And then at the same time, it's not just slowing down the progression of your disease. It's really addressing the root cause of the disease, because it's burning that visceral fat. It's helping you get rid of the root cause of the insulin resistance that is leading to all these symptoms and problems. And so I have really gotten to love the system for my own family and personal, friends, but I use it for all my clients now. So we will end there. But if you have any questions or comments, you want to learn about the system, both Dr. Angelica and I can support you. You kind of get us as a little bit of a virtual coach, if you will. We can't give you medical advice, but we can guide you and empower you. So we do have links in our Instagram bios, so you can go check out the system. if you want to learn more, or just shoot us a message. Let me see if I have any questions here. How much is it? So the way I see this is, a lot of times people say things are very expensive, and it's true, not everything is accessible to everybody. However, the first thing I tell people to do is take an inventory of all the things they spend money on, right? I have not gone into a Starbucks or into an airport or walked by a McDonald's where it wasn't buzzing and there weren't lots of people buying things all the time, right? And so, whether you're investing in a really good pair of gym shoes or whether you're investing in a lifestyle tool like this, I see it as an investment for your future and for your quality of life. And so really the system comes down to less than $5 a day if you're in the US. And yes, it is available in, I'm seeing another question about where it's available. It's available in 60 different countries. So it doesn't really matter where you are around the world, you should be able to access it. So less than $5 a day, I think is pretty phenomenal.
Yeah. And also, if you consider incorporating it with some form of time restricted eating, the money that you're getting back from considering that's one less meal, a day on average, would instantly make up for this lifestyle tool that's really going to support you with getting the most benefit from the time restricted eating. So yeah, that's
absolutely. Well, we're getting some love in the comments. So we will continue to show up. Dr. Angelica and I have a lot of knowledge and a lot of experience through the years. And so for us to come live for 15 minutes, I'm really not even sure if
all right. This is good for right now. And we have a whole lifetime to share more information. So
but we really like to go deep so that you understand the why and not just throw things at you to do.
100%.
Everything before you reach to your outcome, you got to know your why. If you know your why, the how is going to be so much easier. So that's what we're here for. If you have any topics you want us to talk about, we hope to do this for a while now. So every Thursday at the same time. So please send us a message with your topics or anything that you want to talk about, or just show up live and share this with someone who you think would benefit from it and you just don't know whose life you might be saving.
Yeah, so wonderful. Yeah, don't be a stranger. Reach out to us. Our goal is literally to make all of these educational tips and strategies as accessible as possible. So until next time.
Bye, friends.